Hi, my name is Keisha. I'm going to be your nurse today. I'm going to do hand hygiene, put my gloves on. I'm going to pull the curtain and provide for privacy. I'm going to check the identification of the patient on the armband, ask the guardian name and birthday, and make sure all my information matches the guardian's information as well. I'm going to be doing an assessment today. I'm going to be checking the extremities for symmetry. I'm going to be checking the mood of the patient, if they're happy or sad, check for LOC, check their LOC, if their activity level is tolerable for their age. I'm going to check the neuro assessment, make sure the patient is active in response to tactile stimuli and touch and verbal stimuli. I'm going to check the patient's head for hair distribution, any bumps, any bruises. I'm going to check the face for symmetry. I'm going to check the eyes, make sure the conjunctiva is pink, the sclera is white, and there is no discharge. I'm going to check the nose, make sure there's no drainage and it's patent. I'm going to check the ears, make sure there's no drainage. Note if they're low set, or also note the size and shape. If the patient is 3 years or is younger than 3 years, you're going to pull the pinnae back and down, or down and back. And if they're above that age, you're going to pull the pinnae up and back. I'm going to check the mouth, check the mucous membranes, just make sure they're pink. I'm going to make sure the palate is fused, make sure the uvula is midlined, and check the teeth. Check for baby and permanent teeth. I'm going to check the neck for lymph nodes, make sure, see if there's any edema, anything like that. I'm going to check the carotid pulses on both sides, but not at the same time. Make sure all of those are good. Then I'm going to check the chest and back, cardiovascular, make sure the skin, make sure there's no deformities noted in the skin, lacerations, bruises, bumps, things like that. Check the apical pulse for 1 minute, and then check pulses throughout the body, make sure they're all normal. Then I'm going to check the abdomen. Also note the skin, make sure there's no deformities or anything like that. Then I'm going to inspect, make sure, check the size of the abdomen, the shape, the contours, things like that. Then I'm going to osculate in all 4 quadrants. All 4 quadrants. And then since I've already osculated it, I'm going to jump back up and do respiratory. I'm going to check the front and the back for respiratory. I'm going to check the chest for symmetry and expansion. Check to see if there's any shortness of breath, any coughing, and then I'm going to listen to lung sounds in the Z pattern formation. All 5 points. And then I'm going to come back, and since I've already osculated the abdomen, then I'm going to palpate it, check for any pain or tenderness, any swelling, anything like that. Then I'm going to check the genitalia and see if there's any discharge, any bumps, anything, any deformities, abnormal, anything like that going on. Then I'm going to take my gloves off, do hand hygiene, put more gloves back on. Then I'm going to check the patient's extremities. I'm going to check muscles in all 4 extremities. I'm going to check range of motion in all 4 extremities. I'm going to have the patient get up and walk, and I'm going to check the gait, and then I'm going to have them bend over so I can check the symmetry of their spine, make sure there's no deformities there. Then I'm going to check all capillary refill in all 4 extremities. Then I'm going to ask the parents if they have any questions. Make sure the call light is within reach and teach how to use it. Make sure the bed is locked and in lowest position. Then I'm going to take my gloves off and do hand hygienic